A term you might see or hear while working in a pharmacy is coordination of benefits, sometimes just simply abbreviated to COB. This is typically used when dealing with a patient that may have more than one insurance policy. Coordination of benefits makes sure that the maximum amount of benefits are used to pay for a service. One example we've seen before is patients with both a private insurance policy and Medicaid. Sometimes a patient will have two private insurance policies as well. In this case, it may not be obvious without actually asking the patient which plan is supposed to be the primary and which plan is supposed to be the secondary payer. Here's an example of a common coordination of benefits scenario. A patient whose metformin prescription is first billed to their private insurance, in this case the pharmacy benefit manager, Medco, returns the claim with a $10 copay since it is a Tier 1 generic drug. Then the claim is submitted to the patient's Medicaid. This $10 copay is then reduced by Medicaid so that the patient only pays $1 for their prescription. It is important to note that in the pharmacy, this is all done instantaneously and in the background, so you may never actually see that $10 copay because it happened automatically. An important field to be aware of is the dispenses written field, or sometimes DAW. The DAW code that you choose when entering a prescription will have an impact on what benefits are applied to this prescription. If a generic form of a drug exists and is available, insurances will often require this generic to be dispensed. If the patient or doctor is requesting the brand name of the medication instead of the available generic, a specific DAW code is entered into the prescription claim to indicate this. Here's a table that lists the meanings of the different DAW codes. If there's no code indicated on the actual prescription from the patient or prescriber, then the default will always be a DAW code of 0. If the prescriber indicates that they want the brand name dispensed, it is indicated with a DAW code of 1. DAWs of 2 are for patients that request the brand name medication over the generic. These three codes, 0, 1, and 2, will be the most used DAW codes that you will see. However, it will be helpful to familiarize yourself with the others as well. The specific NDC, or National Drug Code, that is submitted in the prescription claim is important. The insurance plan, or PBM, will cross-check this NDC against the other therapies that are related and may provide a claim rejection because of it. When looking at the NDC on medication bottles, remember that there are always 11 digits. You've already learned what each section of an NDC indicates, but this graphic shows it as well. Nearly all pharmacy claims these days are electronic and will adjudicate to the patient's insurance plan immediately. After submitting an electronic claim, it undergoes the drug utilization process, or DUR, before it is returned as either a paid claim or a rejection. Remember from earlier in the course that a drug utilization review, or DUR, is the process of evaluating a prescription claim to determine necessity and appropriateness. Some examples of a DUR rejection you may encounter in the pharmacy are refills that are too soon, doses that are considered too high or low, drug-drug interactions as compared with the patient's other prescription meds, or sometimes even refills that are late and may signal non-compliance of the patient with their therapy.